In our Department of ENT, Apollo Specialty Hospitals, Vanagaram, we offer multiple treatment modalities for varying conditions in ENT. Today, I would like to focus on obstructive sleep apnea and its treatment. Sleep apnea is a term characterized by repeated stoppage of breathing while an individual is sleeping. Now, that can be ranging from heavy snoring to complete cessation of breathing, wherein when the patient wakes up in the morning, either he or she is having an unfulfilling sleep or an unrefreshed sleep. When we talk of obstructive sleep apnea, the symptoms and signs range from as simple as an unrefreshing sleep, as we mentioned earlier, to shorter memory lapses, to daytime drowsiness, and general lack of interest in day-to-day activities. It can also lead to serious C, conditions like non-communicable diseases. For example, diabetes, hypertension, stroke, and even sudden cardiac arrest. When it comes to treatment solutions for obstructive sleep apnea, it starts as basic as a conventional lifestyle and a dietary modification to a usage of continuous positive airway pressure machine, which remains the first line of defense or the gold standard of treatment. However, there are some patients who are either intolerant or non-compliant to these conventional methods, for whom it is possible to explore some minimally invasive surgical procedures. So when we talk of minimally invasive surgical procedures, it's not a one-size-fits-all solution. One has to be diligent in diagnosing the exact blockage in the upper respiratory pathway, thereby deciding on what kind of a surgery a patient will need. So we just spoke of minimally invasive surgical procedures. So what does the surgical procedures do? They either remove the blockage or enlarge the airway. This brings us to a point where we have to identify where the blockage is or where the collapse of the airway is. How do we do that? Whenever a patient walks into our clinic, the step one is to get level 1 polysomnography done, which is basically assessing the physiology of sleep. After which, we go ahead and perform a specific and a unique kind of an endoscopy, which is called as the drug-induced sleep endoscopy. Now, this endoscopy provides us with critical data regarding the anatomy of sleep, the anatomy of the blockage, or the collapse in the upper airway. For those patients who are intolerant and non-compliant to conventional treatments like CPAP and other wearable devices, the minimally invasive surgical procedures have provided significant and satisfying results both for the patients and the doctor.